Today we are celebrating the remodeling and relocation for Compass Behavioral Health. Compass is a leader in behavioral health discovery and innovation since 1961. That's amazing. Joining me is Lisa Southern, the Executive Director for this establishment. Lisa, introduce yourself.
Hi. I know, I'm like, ah. I'm Lisa. I've been at Compass in September. It'll be 30 years. And so I've seen a tremendous amount of growth. And this is one of our newest ventures, moving our medical department to the back of the building. So people that are coming in for medical services can park back here, come into our new reception area, see our medical staff, get their prescriptions filled from Genoa Pharmacy.
Is there anybody you want to introduce?
Yes, yes, I do. I want to introduce Christy.
Come on up, Christy.
Christy's going to come up here. Christy's our medical team lead, and she's going to introduce the medical staff who work here at Compass.
Yes, so Michael Southern.
Come on up, Michael.
Come on, Michael. Michael is a nurse practitioner here. And then we have Lori, who's the nurse. And Tiffany is our receptionist. And Jan is a nurse. I think that's all we have right now, right?
Well, fantastic. Well, let me ask you a couple of questions.
Okay.
So, could you tell me about the 24/7 crisis access?
Yes. So actually, I often refer to it as 24/7, 365. So we are available every day of the week, every night of the hour, Christmas morning, if that's when a crisis occurs. Compass is available for crisis services, and we've added mobile crisis. So in addition to just being accessible, we go where the person is. So for example, 2 weekends ago, I was on call and I started my Friday night on call at someone's home in Lakin who was having some difficulties and needed someone out to come and help her deal with what was happening at the time. So
that's
yep,
fantastic.
That's what
so
we do.
What if somebody wants to schedule an appointment in the office? How do they do that?
Okay, just call any of our Compass numbers. Obviously, we're at this site today, but we do serve 13 counties, and we have offices, fully functional offices, 5 days a week in Dodge City, Garden City, Scott City, and Ulysses. So they can either call or just come in. We have open access, so you don't even have to call if you are not currently a person in service. If you just walk in, we're going to set you up for an intake that day, and then we'll triage you to all the other services that we have to offer.
Fantastic. So if I was to say that you can help provide us with the tools needed to navigate everyday life, I think that's a great statement. Can you kind of give us a little bit about what that exactly means?
Yeah, so one of the things we were talking about when Patrick first arrived is, you know, some people have a perception of who comes to a mental health center, that you have to have like a major mental health issue, but really most of what we see is people with life's daily stressors, and so we help give them some tools to go out and manage whatever's happening in life.
Well, that's great. So what is your actual location and the numbers that they can reach you at here?
Okay, so for this location, because this is pretty much where everything starts for our Garden City services. And then if you need additional services, you might be referred to our CSS program that is also opening drug and alcohol services in that building. And so the phone number would be 620-276-7689.
Fantastic. And we are located right here at, is it 1111
Yes.
East Spruce here in Garden City?
Yes.
Which we're so happy to have you here. It's so important. It's just everyday life has everyday needs.
Yes.
And that's why you're here, and we're just thankful to have you and part of the chamber.
The services in our building so people don't have such a long wait at the line when they first come in. So therapy's at the front of the building, med services are now at the back. People can park in the back, see their med provider, get their prescription, or prescriptions can be sent out. And this pharmacy is not just for Compass people in service. Anybody in our community, in our communities can use this pharmacy, and they just mail it out. And they can keep some really good statistics, so we can make sure that people that we're serving are picking up their prescriptions when they're about to run out, so that hopefully they don't run into the need for crisis services 24/7, 365. But if they do, we're going to be there for them.
Lisa, what all med services do you offer here?
Just psychiatric medication services. Yes, yes. So we have been looking into expanding, but I think it's going to be more of a partnership probably with a primary care clinic instead of being able to actually offer primary care services out of here.
Cool.
But there's so many people who do not have access to primary care. Either the Medicaid quota is kind of already met or they don't have insurance. And so we're trying to figure out how to work that out with some of our local partners.
Cool.
And hours for operations.
Hours, 8 to 5.
And what was the name of the pharmacy again? I'm sorry, Lisa.
I'm gonna have you say it, Amy, in case I say it wrong.
It's Genoa.
Genoa, yes. We've had different ways that we've
And there's over
accentuated.
700 locations across the United States.
Yes.
Fantastic.
And it was started by someone who had a family member with mental health issues who really wasn't staying stable or staying on medication. So really their passion is being in mental health centers.
Fantastic.
Do you offer the mental health services on a sliding scale?
Yes, we do have sliding scale.
Cool.
Absolutely. Yes. So that's income based. People bring in income, how many people they have as dependents in their home, and then we adjust our rates based on that. Yes.
The pharmacy does have a hardship program too to help people who do not have insurance get meds at a reduced rate.
So that's separate from the sliding scale?
Yes.
Correct.
Now, did I understand you correctly? You can come into the pharmacy or have it mailed out. Is that correct?
Correct.
Okay.
We can mail, deliver, or people can come in just for the pharmacy and pick up meds.
Okay. Fantastic. Big cut here and a big cheer. Are you ready?
Yep.
1, 2,